Welcome back. Let's talk about what you need to do if your water breaks. Typically the water breaks during the labor process, but occasionally it will occur prior to labor. That only happens about 12% of the time. So this is what you need to know about if your water breaks. If your water breaks at any time, you always call the on-call provider. That is a situation where you always call, just like bleeding like a period, decreased fetal movement, spontaneous rupture of membranes, or if your water breaks, and preterm labor. You always call about those things. So let's look at this baby right here. Here's a little baby in a uterus with a little amniotic sac around it. If there was a hole in the amniotic sac down low, that creates a large gush of fluids, okay? You will not be confused at all. Your pants will be wet, there'll be a puddle of water on the floor. You'll know that your water broke. If that happens, please call your on-call provider. Now, the situation that's a little more tricky is if you get a little hole in your amniotic sac somewhere in this general area. If that happens, every time the baby kicks or moves around, a little bit of fluid will squish out that hole, and then it'll travel down between the amniotic sac and the uterine wall, and then it's going to pool right here behind the baby's head, because the baby's head works like a cork in the pelvis. So the fluid is going to pool behind the baby's head, and then when the baby gets the hiccups or bounces up and down, the fluid will be able to travel around the baby's head and out of your body. So that situation's a little more tricky. So this is what I tell people. If your underwear is wet and you change into dry underwear, and then a little while later they're wet again, you change again, and they're wet again, that is a situation where you need to call the on-call provider and discuss it and have that checked out. It's always better to be safe than sorry. Now, when you call the on-call provider about your water breaking, they're going to ask you some questions. So there's a little acronym that you need to know about that, and it is COAT, C-O-A-T. C is for color, O is for odor, A is for amount, and T is for time. Amniotic fluid is typically clear and odorless. The amount varies depending on where the hole in the amniotic sac occurs. And time, they just want to know what time your water broke, so they know how long the baby has been exposed to your normal bacteria that lives on your body. So color, odor, amount, and time. Okay, so be sure to note those things down so that when you call your on-call provider, you can answer those questions. The next thing we're going to talk about is preterm labor. Preterm labor is labor that occurs between 24 weeks and 37 weeks. Preterm labor can feel very different to different people. The definition of labor is contractions that change your cervix. But you, like every other woman, you have no idea what's going on with your cervix. So the definition, contractions that change your cervix, doesn't really help. Because people feel sensations differently in their body, some people would think that preterm labor is uncomfortable. Some people experience it as back pain. Some people think it's indigestion. So what I tell women is, if you're having a rhythmical sensation that's coming and going and coming and going, and it's between your breast and your knees, and it's a sensation that you don't normally have, and it's coming and going, you need to pay attention to that. You need to do exactly what you would do with the decreased fetal movement situation, which was, if you remember, empty your bladder, get a big glass of water, lie down, and start hydrating. You're going to put your hands directly skin to skin on your uterus, and you're going to feel and chart every single thing for the next hour. Then you can call your on-call provider and discuss it. They can make a decision as to whether you need to come in and have that checked out or not. But again, like I said, it's always better to be safe than sorry. All right? Thank you. Hi, welcome back. I would like to talk to you about Braxton Hicks contractions. You may have heard this term, Braxton Hicks, and all that means is practice contractions. This is your uterus doing toning exercises to prepare for labor and to make sure that your uterus remains strong. These contractions do not change your cervix, but you can't know that because you have no idea what your cervix is doing. So let's talk about why we have them and a little bit about the anatomy of the uterus. Your uterus was that tiny little fist-sized uterus that weighed 2 ounces, and now it's a big, strong uterine muscle that weighs about 2 pounds. A lot of the increase in your blood volume is going to your uterus to support the muscle itself. Throughout your pregnancy, those uterine muscle fibers contract from time to time. It may be all of them or just some of them in certain areas, toning and contracting to keep your uterus really strong. These are Braxton Hicks contractions. So if you're having a few contractions a day, that's normal. But if you're having 5 or more in an hour, you need to call the on-call provider. Remember what I said about preterm labor? Preterm labor is contractions that change your cervix. If you're having 5 or more contractions in an hour, call your on-call provider. Thank you.